Okay, if you move on down to section G, it lists a number of things that we must do to comply with the law. Number one, we must provide services, programs, and activities in the most integrated setting appropriate to the needs of qualified individuals with disabilities. Number two, we must make reasonable modifications in our policies, practices, and procedures to avoid discrimination on the basis of disability, unless we can demonstrate that a modification would fundamentally alter the nature of our service, program, or activity. Number three, we must ensure that our programs, activities, and services are accessible to and readily usable by individuals with disabilities. Number four, we must provide auxiliary aids at no additional cost to individuals with disabilities where necessary to ensure effective communication with individuals with hearing, vision, or speech impairments. Auxiliary aids include, but are not limited to, services or devices such as qualified interpreters on site or through video remote interpreting services, note takers, assisted listening devices, television captioning and decoders, telecommunication products and systems, qualified readers, taped text, brailled materials, and large print materials. Next, in the handout and in the training, we want to point out some basic facts about HIV/AIDS and the epidemic that we have here in the United States. According to the CDC, that's the Center for Disease Control, they say that in 2012, more than 1 million people were living with HIV in the United States. An estimated 50,000 Americans become infected with the disease annually. 1 in 5 Americans are unaware of their infection. It is important to know about HIV/AIDS because there's a great probability that you will encounter HIV residents in our facility if you have not done so already. Remember always that the civil rights of the disabled are protected and enforced by the Office of Civil Rights at the U.S. Department of Health and Human Services. Complaints of discrimination may be made directly to the OCR. In other words, you don't have to make a complaint to Susan or to me or to Meridian specifically. You can make complaints, or a resident can make complaints directly to the Office of Civil Rights. Next, in section J, we point out that there are penalties that can be imposed on Williamston House for violations of this particular federal law. The main thing you must know is that private lawsuits by the resident affected can be brought against Williamston House for compensatory damages. So if in acting on behalf of Williamston House in your work capacity there at the facility, if you do anything that violates the rights of the disabled, that can result in a lawsuit for a large amount of money damages being brought against this facility. Next, in section K, this is very important, and I want to point out that as employees, you are required to follow our non-discrimination policy. Participation in this training acknowledges that you're now aware of this policy, and violations of the policy can and will subject you to disciplinary action under company personnel policy. Our company will not tolerate discrimination of any type. The Section 504 coordinator, in your case Susan Smith, shall be the point of contact for questions and concerns. If you feel that you cannot safely or effectively make a complaint to Susan or the particular executive director at your facility, then you can also make a complaint to or call me as general counsel from Meridian Senior Living. My phone number is there in your materials. And another alternative is that you can call the Meridian helpline. That number is in your materials. And that helpline is monitored by Audrey Kincaid, a paralegal in my office. Next, in section L of the materials there, you see the main duties of the Section 504 coordinator, and it's important that you understand that. As I said, Susan Smith is your coordinator. And generally her job is to coordinate and oversee the facility's efforts to comply with and carry out our responsibilities under Section 504. Another duty is to attend training with regard to the responsibilities of the coordinator and attend training on the requirements of Section 504 and to review the voluntary resolution agreement with General Counsel. And I can report to you that Susan has already had this training with me and has complied with this part of her duties. A third duty of the coordinator is to be available for you and for residents to answer questions and provide appropriate assistance to the staff and the public regarding our obligation to provide equal services, accommodations, or other opportunities to any individual with a disability. Her duty is also to be responsible for processing any grievances or complaints that Section 504 or the non-discrimination policy have been violated by the facility or the employees. This would include conducting investigations of any such complaints thoroughly, affording all interested persons an opportunity to submit evidence relevant to the complaint. After that, her duty is to issue a written decision on any grievance or complaint within 30 days after its filing. And finally, she has to maintain files and records of Williamston House relating to such grievances. Let me also point out under the grievance procedure that if anyone is unhappy with the decision that your 504 coordinator, or in this case Susan, makes, they can appeal that to me. They can bring the complaint directly to me, and I'll review the action that your coordinator or Susan took on that particular complaint. As I pointed out before, at the very end of your handout, there's a master list that Keena will pass around for all of you to sign. I want you to print your name and sign your name, certifying that you've attended this training. And again, I want to thank you on behalf of Williamston House for being here today and attending this training. At this time, we're willing to take questions, and Keena will gather those from you. And as I said, we may try to answer them now. If not, I think I'll probably pass them on to the Office of Civil Rights and get official answers from them, and we'll get the answers back to you in writing sometime, hopefully not too far in the distant future. Again, thank you for your attendance today, and that concludes the training.